Hello, everyone. Thank you for watching this video on test-taking strategies according to the test formats, and this includes the next generation NCLEX. My name is Carissa, and I am from the College of Nursing Education and Training, Australia. Before we begin, I'd like to introduce to you the College of Nursing Education and Training, Australia. So this is Cassandra. She is an internationally qualified nurse from Cebu City, Philippines. She happily shared her photo to us to encourage overseas nurses that you can make a significant achievement in your career and also in your life, no matter where you are, if you only believe and reach for your dreams. Thank you once again for making the time for this information session or this demo class. Just some fast facts about the College of Nursing Education and Training Australia. The College of NETA is a leading provider of NCLEX and OSCE in Australia. With up to date, the most number of RN products among all preparation course providers, and we have established ourselves for NCLEX and OSCE preparation since the beginning of the OBA process, which was in year 2020. The College of NETA was also awarded as a most trusted nursing education for overseas nurses by the Global Management Excellence Award in October 2022. We're also proud that we received in the same year an additional award, which was the NCLEX and OSCE Review Provider for Overseas Nurses of the Year. And this was received in December 2022. And this was awarded by the Business Achievement and Recognition Award. College of NETA has everything you need kind of facility. We have the state-of-the-art facilities, and you will have everything you need to pass your NCLEX and OSCE. There are more than enough resources, from your learner's portal to your classes to pathways, tools, charts, cheat sheets, resources. You can also contact your educator at any time, and you'll get full support from start of the process to the finish. To know more about our facility and the great amenities that you can use, check our YouTube account and select Facility Tour. The College of NETA also does employer introduction, so you can work while you prepare, or work when you have your registration, depending on your choice. Our support goes above and beyond NCLEX and OSCE. We have industry partners from aged care to hospitals and critical care across Australia that offers incentive, sign-in bonus, and also loyalty bonuses to their staff. And of course, we take pride by giving back to the community. So we take part and we make ourselves as a contribution for the greater good of where we work and live. We are supported by the region, the council, and the community. And what a great way to give back to everyone. So you can see us in community events. And of course, this is a big congratulations to all our pioneering successful RNs in the beginning of OSCE in Australia. From then, we have made over hundreds of successful RNs. You can see students' testimonial through our website at www.collegeofneta.nsw.edu.au/testimonial. So let's connect. We are located at Level 1, 222 Bailey Street, Wagga Wagga. And we also have facilities across Australia. Our Sydney office is located at Pitt Street in Sydney, and our Melbourne office is located at Little Collins Street in Melbourne. We do provide also in Brisbane and Adelaide. And that's our contact details. And hey, we're active in social media, so follow us in Facebook, Instagram, and TikTok as well. All right, so let's look into the test-taking strategies according to test formats, and that is for the next generation NCLEX. A lot of you have probably thought of what it looks like and what are the just sample questions that we will be discussing in our class. So there are different types of questions now in the next generation NCLEX, and one of that is cloze question, where you need to do a drop-down, just like a drop-down item. So we can look into an example in our screen. So we've got the nurse is preparing to administer intravenous and fractioned heparin infusion to a client with pulmonary embolism. The nurse's priority is to assess. You click onto this arrow and then you'll get a drop down. And you'll have different choices and you need to select only one. Then there'll be another question that will ask you. The nurse also knows that the medication will need to be withheld if, and then you'll have another drop down and you will select from there. So it's like a multiple choice question. However, it is also like a fill in the blank. So it's actually fill in the blanks with choices. So that makes it easier, isn't it? So let's look into this question. So the nurse is preparing to administer intravenous unfractioned heparin infusion to a client with pulmonary embolism. Then as a nurse, you'll think, okay, yeah, that makes sense. PE, heparin infusion, that's fine. And the nurse's priority is to assess. So this means that in NCLEX, it will ask you, what is your priority intervention and what it is that you are going to assess. So let's look into the choice in number 1, which is your current INR. Choice number 2 is current hemoglobin. Choice number 3 is availability of vitamin K. And choice number 4 is current antiplatelet medication. So what are you going to assess when you have an unfractioned heparin infusion? So let's look into this question. So what are the keywords here? So we've got, let's highlight some keywords here. So you've got an unfractioned heparin infusion. And of course, this is indicated for pulmonary embolism. But what are the things that you need to assess when a patient has heparin infusion? So let's look into the choices. Current INR, is that something that you will assess when there is a heparin infusion? So we will understand that the INR is for warfarin. So that couldn't be our choice. But let's have a look at the others. Though for warfarin, we can check INR plus APTT, you know that for a heparin infusion, it is best to check APTT. Next one is current hemoglobin. So is there a relationship between hemoglobin and heparin? Then you'll think, probably not. There must be a relationship between platelet and heparin, but not much of hemoglobin. So then you will just cancel that. The next one is availability of vitamin K. What's the relationship between vitamin K and heparin infusion? Then you go, vitamin K is a clotting factor. Heparin is an anticoagulant. So do they have any relationship? They say, yes, it could be an antidote, but then we'll recall on your knowledge and you'd know that vitamin K is an antidote for warfarin. But what is the antidote of heparin? Then you would know that it's protamine. So would you assess availability of vitamin K? Probably not. You'll assess availability of protamine. And the next one is current antiplatelet medication. What does it do? Then you go, okay, antiplatelet, heparin. Of course, we don't give them together, or there needs to be a medication review by the physician if this is given together. So would you assess the current medication of the patient if there is any antiplatelet? Yeah, definitely, we'll do that. Therefore, because current INR is for warfarin and it's APTT for heparin, the best answer there is current antiplatelet medication. The follow-up question will then ask, the nurse knows that this medication will need to be withheld if, number 1, the client is hypersensitive to pork. What's the relationship between pork and heparin? So if you don't know, probably something that we will skip later. But again, just for the information of everyone, that the heparin is actually made from derivatives of pork intestines. And so if the client is hypersensitive to pork, work, then probably this medication needs to be withheld. Okay, but we'll wait and let's see if the rest of the answers are wrong, and then we will know that the first choice is our answer. History of DVT. If there's a history of DVT, and now we're going to give a heparin infusion, that probably is not a contraindication, right? So that's not something that, unless there's a history of bleeding, then maybe we will reconsider, but not really withhold also, but reconsider. But if there's a history of a clot, then that's probably something that is okay to give heparin infusion. So that's not something that we will withhold the medication. An apical pulse of 112, there is no direct relationship between the pulse rate and the temperature of the client. So a client who's tachycardic or a client who's got fever can still receive heparin infusion. Then that makes sense. Our answer is the first choice. So that is a close question. Let's proceed to the next test format. This is what you call the extended drag and drop. So the nurse is admitting a client to the unit. The nurse understands to implement the nursing process, drag to the opposite side of the box the order that the nurse performs using the nursing process. So you'll have notes next to you. And when you address this question, this is for you to drag and drop. Now, when we talk about extended drag and drop, it says there that you may use all, or there are also items where you can only use some. So you will have, say, 8 choices here, and you'll only need to use 4 or 5. In this scenario, let's have a look if we can use some or if we need to use all. Now let's look into the nursing process. So I want you to recall, what is the nursing process? Great. That's your assessment, your nursing diagnosis, and you've got your planning, your implementation, and then your evaluation. Add pi. So let's have a look. The first one here should be assessment, then we diagnose, then there is planning, then there's intervention, and then we have to evaluate. So the first thing that you need to do here is really to check on the sentences first before you drag them, because you really need to make sure that you are getting or you are selecting add pi. The nurse checks for history of present illness, conducts a head-to-toe assessment, and takes the vital signs. That sounds so much of an assessment, isn't it? Let's look at the next one. The nurse processed the information and has identified the nursing problem. Processing of information, identifying the nursing problem sounds like diagnosis, right? Nursing problem or nursing diagnosis can be used interchangeably. So that is your D. The nurse ensures that the interventions have worked and reflects on what can be done better next time. Check if the interventions have worked. Is that planning, intervention, or evaluation? Looks like an evaluation, because the word reflection there actually is a good hint of the word to evaluate. So that's your evaluation. The nurse demonstrated the skills according to the care plan. Demonstrated according to plan. That sounds like intervention. And the last one, the nurse creates a care plan for the client. The keyword there is plan, and you know that that's your planning. Therefore, that's your P. So let's arrange them by dragging them to the right order. So let's take a look. So the first one here is okay. So the first one here is your A. So that goes to the first side of the screen. Then you have your D. So you'll just drag that to the other side. And then you got your P, which is next, which is your number 5. And then you've got your I, which is your intervention. And then you got your E, which is your evaluation. Check if it has worked and you reflect on it. So that is your extended drag and drop. Let's move on to the next. So that's your NCLEX question or bowtie question. So a patient is complaining of severe right leg pain 4 days post-abdominal hysterectomy. Upon assessment, the nurse notes swelling, tenderness, and redness around the pain site. The nurse reviews the patient's care plan and noted that the patient has refused mobilization exercises with the physiotherapy. Drag and drop: 1, potential condition; 2, actions to take; and 2, parameters to monitor. So let's drag and drop 1, potential condition. So how do we do that? So you can see that this sort of looked like an ADPI process. So the first one is your history taking, that there is a severe right leg pain 4 days post-abdominal hysterectomy. Then you got your assessment, that the nurse notes swelling, tenderness, and redness. So that is your assessment. Now let's process this information and check, what do you think is a potential condition? Let's diagnose a problem for this client. But then it says here that you review your care plan and you've noted that the patient has refused mobilization. No mobilization, no exercise with the physiotherapy. So what could be the potential problem? So let's have a look at your choices. Number 1 is wound infection. So let's go back to our history and also to our findings. If these findings or your assessment is related to a wound infection. So you go, the nurse notes swelling. Yeah, could be a wound infection. Tenderness. Yeah, could be a wound infection. Redness around the pain site. Yeah, could be an infection. Severe right leg pain. Could be an infection, but the word severe here is quite strong. So that is probably a keyword. Now let's look into some of the things in the care plan. The patient has refused mobilization exercises. Could be a wound infection also. So let's leave that there because we need to check if this makes sense if we choose wound infection. The next one is cloze fracture. Now, obviously, severe pain, yeah, probably a cloze fracture, but is it related to your, there's redness, tenderness around the pain site. But there is a key information here, and that is refusing mobilization exercises. So definitely we say, okay, so that's not a cloze fracture. Is it compartment syndrome? Well, compartment syndrome is a neurovascular condition. And in this case, you can see here that number 1, there is a severe pain to the right leg. Does compartment syndrome have swelling, tenderness, and redness? But is it also related to refusing immobilization? Probably not. Probably more of the bandage and attending to a fracture. So not compartment syndrome. Then we've got deep vein thrombosis. Severe leg pain, yes. 4 days abdominal hysterectomy, so probably a surgery, and this patient probably was not mobilizing as usual. There's swelling, yes. There's tenderness, yes. Redness around the pain site, yes. And refused mobilization could be a factor also. So is it really more of a wound infection, or is it more of a deep vein thrombosis? So in this case, you will say, yes, it is more of a deep vein thrombosis. So your potential condition would go to deep vein thrombosis. Okay, so then that goes, let's just put it in there. Okay, so that's your potential condition. Now, what are the actions that you need to take if your patient has deep vein thrombosis? Number 1, prepare for leg ultrasound. Number 2, administer antibiotics. Number 3, notify healthcare provider. Number 4, assess for pitting edema. Now let's take a look at the actions that we need to take, and we need to pick up 2. So of course, you will do a leg ultrasound. And the second one is to notify the healthcare provider. Why not administer antibiotics? So we don't administer antibiotics because this is only for infection. And probably, yeah, maybe in the future, but that is just not our priority at this point, right? So we can put that in there, and then just sort out some things that we can do, so we can just cover that. Okay, so 2 actions to take with a deep vein thrombosis. You'll go prepare for leg ultrasound and notify healthcare provider. Why not assess beating edema? So assessing for beating edema is probably something that you can do, but not really related to your deep vein thrombosis. All right, what are the 2 parameters that we need to take? So we can see here our choices. So we do have capillary refill time. So probably we can do that for a compartment syndrome or a neurovascular assessment. So we don't do that. T-timer, yeah, that's very significant for to check for any clots in the body, right? So we can do that. And pain level. What about leukocytes? Probably for infection. So what is really significant here would be your pain level and your D-dimer. So this is how your bowtie question would look like. So if you get this all right, then you will have the correct NCLEX question for this. So 1 potential condition, which is your deep vein thrombosis, just highlight what is being asked here. 2 conditions to take, which is prepare for leg ultrasound and notify the healthcare provider, and 2 parameters to monitor. So you need to monitor the D-timer and the pain level of this patient. Well done. Let's go to the next one. The next one is charts or exhibit. And this is just the same as the other one in the previous NCLEX. So in your NCLEX, you won't see this information yet unless you click on the exhibit button. So prednisone is prescribed for a hospitalized client with severe rheumatoid arthritis. Which daily laboratory result should the nurse monitor most closely? Click on the exhibit button for information. Right, so you can see here the information. Your patient has a history of diabetes mellitus, gout, and hypertension. And your patient's in insulin, allopurinol, atorvastatin, metoprolol, ramipril, and now on prednisone. Diagnostic tests include ECG and chest X-ray. So let's look into here. When you click on the exhibit button, you can see this, but let's look into the choices. What is most related to a prednisone and your client's history? So your patient has diabetes mellitus as well, and we would know that a patient who's on prednisone will increase the cortisol level, which will then increase the blood sugar level of your patient due to a resistance to insulin. So you can see now diabetes and prednisone are really correlated. So will you check lipase level when your patient's on prednisone? Probably not. Will you check chloride when your patient is on prednisone? So of course you'll also say, no, you won't. Will you check uric acid level? You probably check for your gout of the patient, but not really because the patient is on prednisone. So let's also cross that off. And what remains here is your blood glucose level, which is related to your diabetes, which is related to your prednisone. So if you reflect on your answer, the best answer there is number 4. The next question is an illustration. So this is still the same as the previous one. This is just an alternate test format. So the nurse has an assigned client in the emergency department that presented with a closed fracture. The nurse knows that the following, except one, is an indicated nursing intervention. So if you attend our NCLEX classes, you will know what negative query would mean. So this is a negative query kind of question. So which means that all of these are interventions except for one. So which one would you choose? So these are illustration, which means that you will be provided with images and you need to choose from those images. So you know from previous knowledge that when there is a closed fracture, our intervention will be our RICE therapy, if you remember that right. So RIC. So you'll need to have your rest, which is number one. And because we are looking for except one, so this is an intervention that becomes not an answer. Then we have our eyes, which is there's heat. So that's kind of opposite. So let's leave that. That could be an answer. But we have our C, which is compression. So that is an intervention. So that's not except one because it is an intervention. And the last one is to elevate, which is again an intervention. So all of these are intervention except one. And your answer there is heat, because obviously it should be an ice therapy rather than a heat therapy. What test-taking strategies are helpful in answering a matrix and grid question? So this is actually a new one also, where there is a grid question. So let's have a look. A patient presented to the emergency department for fever, noisy breathing, and other respiratory signs and symptoms. The nurse identifies a patient history of asthma. Below is a matrix to help the nurse identify conditions for asthma versus pneumonia. For each finding below, tick to specify if the finding is consistent with the disease process of asthma and pneumonia. Each finding may support more than one disease process. Each column must have at least one response. So let's dissect this question. So number one is it's telling us the history that the patient's coming in for fever, noisy breathing, and other respiratory signs and symptoms. And the patient has a history of asthma. So this is the matrix, or this is the grid. And let's look into what they want us to do, what NCLEX wants us to do. For each finding below, so in every finding below, so these are our findings, tick to specify if the finding is consistent with the disease process. So we will check if the finding is consistent to whether it is an asthma, whether it is whether it is pneumonia. Okay, so we'll need to tick. The next one is each finding may support more than one disease process. So maybe we can tick both too, because it says here that each finding may support one or more. So we can tick 2 for one item. And it says here each column must have at least one response, which means that every finding will have at least one answer. Okay, so we don't leave anything blank. So difficulty of breathing, is that consistent of asthma only, pneumonia only, or asthma and pneumonia? So of course we'll say difficulty of breathing, yeah, could be asthma, could also be pneumonia, right? What about wheeze? So we know that wheezing is significant for asthma. What about RALS? So we know that RALS is also significant for pneumonia. What about fever? Because of the infection, then it is very significant to pneumonia. Decreased oxygen saturation, we know that it is significant for asthma. Is it also significant for pneumonia? Yes, of course. And other symptoms of allergic reaction, we know that allergies is related to asthma. Is it also for pneumonia? No, not pneumonia. So this is how your answer will appear in your grid questions in NCLEX. And we'll do the last one. And this is enhance hotspot or highlighting items. So this is, let me just take out this drawing so it's easier for us to highlight. Okay, so this is highlighting the findings of a specific condition. I'm just changing that because there are only 4. Okay, so the nurse is reviewing the information in the progress notes. Click to highlight below the 4 findings that may indicate findings of cerebrovascular accident, CVA, a patient with a stroke. So let's have a look at 4 findings that will say, yes, that is a condition of a stroke. So let's have a look here on the notes. So the client is admitted to the medical ward for further assessment. Finding or not a finding? No, it's not a finding. The patient is alert and speaking in full sentences. Is it a finding or not a finding? Yes, it is a finding, but is it a finding of a stroke? Alert, speaking in full sentences? Probably not. Respiration of 20 breaths per minute. So it's not consistent with a stroke. An oxygen saturation of 98% in room air. So yeah, it could be a stroke, but it's normal. So it's not related to a stroke. Blood pressure of 132 on 84. Again, it's not related to a stroke. And heart rate of 100 beats per minute, regular in rhythm. Is it related to a stroke? No, it's not. Pleasant confusion observed with GCS of 14. Yes, that could be significant with stroke, isn't it? Because a patient could be confused because, again, it's a neurological condition. So yes, that could be. So then we can highlight that. Patient has a clear facial droop to the left side. The facial droop is actually something that is significant of a stroke. Slurred speech noted. Again, yeah, that is very significant. Slurring of speech is related to stroke. No pain verbalized, not significant. Upon assessment of limb strength, client is noted to have left-sided weakness. Yes, significant to a stroke. The client has been referred to the medical team for further evaluation, not a finding. So you can see here that you'll have 4, as what they said, highlight 4 findings. So this is 1, pleasant confusion, 2, facial droop, 3, slurred speech, and 4, left-sided weakness. What about if you only highlight 1 word? Will that make you wrong? We will discuss that in our classes, in our NCLEX classes. So it's good that you join us in there so we can discuss that with you. Well, thank you very much for your participation. Again, we will be very delighted to get in touch with you, so please feel free to contact us. Thank you and goodbye.